Timely access to primary care physicians and specialists is widely recognized as the foundation of an effective and efficient healthcare system. This is especially important for improving access to our very vulnerable population. Yet in reality, healthcare in Ontario is complex, diffuse, and challenging given the changing needs of the population. My name is Silvie MacLean, and I work as a full-time faculty at the School of IT at Fanshawe College within the Health System Management postgraduate program. As a principal investigator of the study, I'm grateful for receiving support by Fanshawe College's Research Innovation Fund and the School of Information Technology for a one-year community social innovation study that involved providing a student with a signature learning experience. I contend my student research assistant, Isabella Calderon-Uribe, had an opportunity to really learn about becoming a boundary spanner to promote social justice, equity, and fairness. This research project focuses on addressing a gap that unlocks specialist resources for primary care physicians to improve access to vulnerable populations, specifically children, geriatric populations, and mental health patients. This study involved investigating a key question: why are sessional fees being underutilized by primary care physicians of the Thames Valley Family Health Team? To date, the Thames Valley Family Health Team, comprising of 122 physicians across London, Middlesex, Oxford, and Elgin regions, have not been utilizing sessional fees to its full capacity. In essence, of the $210,000 they receive each year, an average 9% is used, which means the remainder of the funds go back to the Ministry of Health and Long-Term Care, while many populations require improved access to specialists. That means a total of approximately $1.9 million has returned back to the ministry since 2010. You're probably wondering, what are sessional fees? Sessional fees are an alternative payment plan fund that is separate from the regular Ontario Health Insurance Program fees, which a physician could bill to communicate with specialists. These expenses range from $429 to $575 for a physician to receive clinical consultation with a specialist for up to 3 hours to cover for all medical consultation, incidental, and expenses. This covers for specialists for psychiatry, internal medicine, pediatrics, and geriatric care. However, this issue is more complex given the interorganizational relationships of a family health team. This particular family health team is the second largest family health team in Ontario, with 18 medical sites across 3 regions. There are 147 employees, and they are funded 100% by the ministry. The physicians that work at the family health team are billing separately to OHIP. They service 158,000 patients, which results in approximately 1 million patient visits per annum. It's important to recognize that the budget of the family health team, which represents $12.6 million, does not cover for any of the physician billing for OHIP. However, this budget covers for all the nursing, specialized allied staff such as occupational therapists, social work, dietitians, pharmacists, physiotherapists, and administrative staff. So the money for the sessional fees are therefore given directly to the Thames Valley Family Health Team, but only the physicians can use this form of alternative payment plan. Our methodology began with a literature review that included a comprehensive annotated bibliography. Second, an environmental scan was completed that included evaluating the financial statements from 2010 to current to better understand the problem. Key informant interviews also took place with the executive director and the medical director of the Thames Valley Family Health Team. From here, we divided data and tested into segments of information to submit an application to Fanshawe College Ethics Board for approval. Our research study involved a sequential explanatory mixed methods design. The mixed methods involved a qualitative plus a quantitative approach, which then was triangulated. The study was labor-intensive given physicians worked on diverse sites across 3 different regions. The qualitative component involved in-depth, semi-structured telephone interviews with 14 physician site leads across 3 regions. Physician leads are those who provide strategic leadership as well as clinical care at the Thames Valley Family Health Team. Their primary role is divided into both an administrative and clinical component. This information was gathered over a 3-month period. From this information we received from the physician leads, themes to address barriers and gaps of why sessional fees were not utilized were collected and evaluated. The quantitative involved a 22-question survey using a 7-point Likert scale. Of the 122 physicians, 56 physicians responded. This resulted in a 47% response rate. The quantitative results were analyzed using Excel pivot tools using different count formulas for each question. The triangulation converged the sources of information, interviews, documents, survey feedbacks, and artifacts. Three key themes emerged from this mixed method that verified three consistent gaps. One key theme that emerged was the need for knowledge and skills. 43% reported they were not even familiar with sessional fees and how they worked. However, the data did suggest that many felt that they had somewhat clear description of what sessional fees were. There was a clear majority that 80% of the physicians never even used sessional fees. A second theme was the need for increased promotion and utilization of sessional fees. 65% reported a lack of promotion of sessional fees. A key message received was that physicians expressed communication barriers among their team to learn about sessional fees. Furthermore, 22% of physicians said that if there were to be more promotion of sessional fees, they would feel somewhat inclined to use them. The third theme was the lack of collaboration. 60% of physicians reported a lack of interaction with specialists. Such problems arise from differences in culture, processes, structure, and space, and the ability to instigate and maintain the interaction with the specialist. What we learned from this study and what we will be recommending to the Thames Valley Family Health Team physician and staff is that there is a need to increase knowledge, skills, and training by way of investing time with primary care physicians to interact with Thames Valley Family Health Team staff and specialists. This requires not only time, but adequate tools that are easy to understand and accessible. An emphasis on supporting collaboration by focusing on interdisciplinary team-based interaction rather than on standardization practices. What this really means are friendly reminders of patients that can be flagged on their files to receive specialist consults. To promote and essentially increase utilization of sessional fees, the development of care maps, videos, and brochures can be developed. The last is making space for strong and meaningful connections within the system and create opportunities to adapt, innovate, and learn. A limitation of the study is that it focused only on primary care physicians. Therefore, staff and specialists were excluded. It's also focused on one family health team. What physicians, Thames Valley Family Health Team staff, and we as researchers learned from the study is the importance of relationship building, the meaning of sessional fees, and experiential solutions required as diverse agents within and outside of our healthcare community to work through issues to co-create and achieve innovation. Overall, we believe that there's a further opportunity for Fanshawe students to continue to be boundary spanners in the healthcare community, to develop the tools, educational materials, care maps, and videos. We also believe the space of Innovation Village is an opportunity for our Fanshawe students to be actively involved in solving community problems such as the one we undertook. We are grateful to Dr. Eric Wong, the Medical Director of the Thames Valley Family Health Team, the primary care physician leads, and all the physicians who took time to participate in this research study. One thing is for certain, Fanshawe's role in the healthcare community is growing, and faculty with their students are interacting, problem solving, and building adaptive capacity to generate innovative ways to meet diverse and changing students' needs and expectations, just as we are for our population.